First, though, on BBC Radio Stoke, we're going to talk about dentistry. When you go, it's not normally that far from home, but with us this afternoon, a dentist from Stafford who's travelled thousands of miles to treat children and teach them about dental hygiene. Richard Howarth is from Smile Style Dentists in Stafford, and he's just come back from a trip to Morocco. He's here to tell us about that and also to answer any questions you've got about your teeth, your mouth, your gums, dentures that are rubbing, anything at all that you'd ask a dentist. You can do it now without having to sit there and listen to the drill in the background and all those other horrible noises and smells you used to get in dentist surgeries. Richard, good afternoon. Thanks for coming in. Last time we spoke, you said, I'm off to Morocco soon. So we thought, right, he's back. Let's ask him what he's been up to.
Well, I'm a trustee to a charity called Dental Mavericks, and I've been travelling to Morocco now for 6 years. I spend 2 weeks a year, 1 week in May and 1 week in September, in 2 different areas, either up in the Atlas Mountains or the Rift Mountains, working in remote villages where they've got very little transport unless it's a donkey or a mule, and no access to dental care. Unfortunately, they have horrific mouths out there based on their diet, the lack of a toothbrush and toothpaste, and they literally have to live with teeth rotting out of their heads, which you can imagine is extremely painful.
Well, I was going to ask you about that. I mean, we're kind of conditioned to think toothache hurts, and it may be that's because it does, because I suppose there's lots of nerves in and around your mouth. It must be agony for them.
Yeah, I think it was summed up for me when we met one of the headmasters from one of the school, and he was explaining to us that he hadn't realised why so many of the children in the school were so disruptive on certain days. And suddenly we'd come in there, we treated all the children, and he said it was just the first day I've had nobody with toothache.
So what kind of things are you doing out there?
Well, we started off when we first went out there, literally relieving pain, so it was basically taking out rotten teeth. The kids had to consent to that, so we work with translators, and really we asked them, are you in pain, and would you like us to help you? And then if they did, we would then assess them, and those that we could help simply we did do. But we've had to take out a first adult molar teeth out of 8-year-olds, 9-year-olds. So they really do have bad teeth. This trip, there's always one child who breaks my heart, and this time had a little girl called Nora, and she had her mum brought her in. She'd been crying for weeks with rotten front teeth. They were baby teeth, and I literally had to take out her front 6 baby teeth. We obviously did that with pain-free techniques. She was amazing. Didn't even no tears, nothing, and obviously her mum was so pleased that we'd helped her out. She was there later on with soup for us and figs and things like that, just as a thank you, because they haven't got anything, so they usually bring some food in.
We're often told, I think, that one of the reasons our teeth go bad is because we have so much sugar in their diet. Is that the case in Morocco? I suppose there's actually quite a lot of sugar in the figs and things like that.
Yeah, they have got a lot of sugar in their diet. They do have access to the worst Western stuff that we provide as well. Good old fizzy drinks, good old sweets, but they don't have the culture of brushing their teeth. One reason is you can't go into the local shop and buy a toothbrush. The shops, there aren't shops like we would imagine shops. It's usually in somebody's front room. There's no toothpaste, there's no fluoride toothpaste. So one of the things that we do is we provide the schools with toothbrushes, we provide them with toothpaste, and we do that on an ongoing, regular basis throughout the year, so that gradually we'll hopefully get them into brushing their teeth.
And the lessons on how to use them. I remember when I was a child going to the dentist, I had to show them, I don't know if you still do the pink tablets in children's teeth these days, to when you missed in a bit, all that stuff.
Yeah, purple dynamic.
That's it, that's the one. Now, I know you're off to Greece as well soon to visit the Syrian refugee camps.
Yeah.
Have you any idea what you're going to face when you get there?
Obviously, we're working with their agencies, and they've obviously given us really hefty briefs on what's going on out there, but all I know is it's going to be very, very, very different from what we're used to. We're going to be seeing people who are like ourselves, had a job, professional people who've literally had to leave everything behind, and whatever they've got on their back is all that they've got left. So they're probably going to have quite different mouths. I suspect we're going to see crowns, bridges, restored teeth, maybe people who really wanted to, brush their teeth, but at the moment still haven't got access to a toothbrush. So, yeah, really don't know precisely what we're going to see, but I know it's going to be very different from what we see in Morocco.
We'll talk about teeth a little closer to home. If you've got any questions about yours, happy to put them to Richard this afternoon. You can do it yourself. If you want to call me, 01782 208 008. Richard Howarth with us on BBC Radio Stoke.
BBC Radio Stoke.
Stuart George.
Proud of where we live. BBC Radio Stoke.
Talking about teeth on the show this afternoon. And with us is Richard Howarth. He's a dentist based in Stafford. Eddie's called from Burslem, Richard. He says he's got 4 or 5 teeth he thinks need removing. How should he go about it? Sounds like he's got his toolbox out and he's ready to go.
Don't do it by yourself, Eddie. You need to find it. You need to find a dentist, definitely. And the first thing to do on that score is to ask a female. Generally, it's the women in our lives who know all the health tricks, all the health people to go and visit. So go and get some counsel, get some advice from your female friends on who they would recommend as a good dentist or a good practice to go to. And I think that's where I'd start.
I'm guessing from Eddie's question, he probably hasn't seen a dentist in a while. If you want to register with one, you've got your NHS ones and you've got your private ones.
Yeah.
How do you make a decision and how do you find out where there's availability?
On the NHS, if you rang up NHS Direct, they'd be able to tell you which NHS practices are taking on patients at the moment. So it's literally a short telephone call away. In terms of private practices, it's just a case of ringing round. Certainly, I would think most private practices don't have a waiting list, and you'll be able to join straight away.
And for those who haven't used the NHS dentist system for a while, you still have to pay, don't you? It's not free for most people.
No, it's not free for most people. You have to be on benefits of some sort to get help with your dental charges, but otherwise you have to pay. Yeah.
Okay, if you pop some headphones on, if you've got some over there, let's hear from John, who's in Hanley. Hiya, John.
Hi, Stuart. How are you?
I'm very well, thank you. How can we help?
What it is, a few years ago, didn't look after my teeth as well as I should have done, so the little tooth next to my 2 front teeth went. We tried pillars and posts and it didn't work, so in the end my dentist shaved the incisor and put a double cap on. So that was great for many years, but we didn't realise that infection was going on and decay, and it snapped and it's now out. So I've got a double gap. We've got a denture, but I hate it. And I can't speak without it, and I can't speak with it. So I know there's not inserts, is that the right word?
Implants.
Yes, that's right. Is there any alternative to that?
There are alternatives. Ultimately, at this stage, we've only got 4 choices when it comes to replacing missing teeth. One is living with the gap. Well, that's not going to be acceptable for you. You're already trying living with a denture. The next option would be another bridge. You've called it a double cap. We call it a bridge. But obviously, each time you lose another tooth, the bridge is spanning a greater span. So to replace 2 teeth, you're probably going to need a bridge which is 4 teeth. So using the 2 teeth, a bit like going across a river. You've got to have something on each bank, and therefore you would crown the 2 teeth either side of the gap and make something which looks like 4 teeth. But obviously it depends on the quality of those 2 teeth on the bank. You can imagine if it's not very good quality land on one side of the river, you may not be able to build a bridge at that point. So these are the sorts of things which need to be assessed by the dentist and see your suitability. And obviously the final option, which maybe, I don't know, perhaps you could elaborate why you put off implants, is the final way of replacing missing teeth, which is the way most dentists would replace a missing tooth if it was their own tooth they were missing.
Yeah, yes. Just on implants, what's the sort of, how long they've been around now, and what's the sort of research on them, and are they, you know what I mean, are they 10, 15 years down the line, are they still good?
Yeah, well, implants now have been, we've been using implants the whole of my career. I qualified in 1988, and by gum, they've improved dramatically over that time and the way we can use them. The research is very good. There is not a 100% solution for anything. They are very successful. We're achieving certainly very high 90%, 97, 98% successes with implants over considerable numbers of years. But there is no one solution which is 100% successful. So you've got to go in cautiously. But if you asked any dentist if they lost a tooth, would they or would they not have an implant, I think you would find 100% of them would say, I'll have an implant.
John, thanks for your call this afternoon. Good luck with that. Some food for thought there from Richard. If you've got a question about your teeth or bridges or, I was going to say other people's teeth, but I mean dentures really. I mean, you don't want second-hand ones. 01782 208 008 is the number to ring. Lucia has the latest travel. Richard Howarth from Smile Style Dentist in Stafford with me this afternoon. Lots of you getting in touch with questions about your teeth. A texter's been in touch and says, I'm 72, my teeth are crumbling, but I'm too scared to go to the dentist. It makes me sweat just thinking about it. How do you approach that? We've already said ask a woman, because they'll know. But are some dentists, do they kind of specialise in, because I'd be a really nervous patient as well, in nervous patients?
Yeah, there's definitely a whole raft of people dentists now who are helping phobic patients. Obviously, the internet's a great source. Just type in, dentists who deal with phobics, and a whole load of them will pop up. Pain-free dentists. That's the sort of thing that I'd go searching for, and then start reading their testimonials, and then pick up a phone and have a chat with them.
Do you see patients who come into you and their teeth are in more of a state than you might imagine, and they say, I've been in agony for years, but I just couldn't get through the door?
Yeah, I see that at least 2 or 3 times a week. We get patients like that. It's sad that they are completely handicapped by the fear, whether it's from a bad experience in the past or whether it's just somebody said something to them, I had a really bad experience, and that's enough to, people love telling their bad stories, don't they?
Well, it's like the point we just had about implants is years ago they had a bit of a bad reputation for a time, didn't they? And now it's, from what you're saying, quite different, because from what I've read and what I've seen, it's quite an invasive thing because you have to go into the jawbone and you screw things in, but the idea is they're permanent, isn't it?
It may be invasive, in that sense, but it actually has to be done exceptionally gently, because I think putting an implant in is less traumatic by probably 80 or 90% than taking the tooth out in the first place, because we're dealing with live bone, and the way an implant works is the bone actually has to grow onto the implant, so we get a complete union. It's medical grade titanium is a very strange metal. The body doesn't recognise it as being foreign, and therefore it literally will grow onto the special surfaces that we produced it on the implants. And for that to happen, you have to treat the bone really, really gently. So very low forces, everything's done stepwise, I ask every patient who's had an implant afterwards, if you lost another tooth, would you have another implant? Even all the scaredy ones have said to me, yeah, I'd do that again. I was nowhere near as bad as I thought it was going to be.
Fascinating. Dave's texted and he says, is there a real difference between a 59p supermarket toothpaste and the best around more expensive brands?
I don't think there actually is, because everything that we sell in this country has to be tested and licensed to be produced, so it'll have a CE mark somewhere on it. The key bit is you need to look at what's actually in it, and the key bit is the fluoride content, which for an adult is 1 in 40,000 parts per million. And the other thing that you may get in a slightly more expensive brand is a lot more testing on abrasivity. Obviously, when we brush our teeth, the toothbrushes that we use nowadays in this country really don't produce much in the way of wear. Our teeth are that hard that the toothbrush wears. I'm sure you've seen your bristles all go splayed.
Yep.
However, if you put toothpaste in there, it's the toothpaste which is the abrasive bit. So it's a bit like scrubbing your sink with Vim or something like that. It's the toothpaste that's abrasive. So they should have very low abrasivity by law, but there are some toothpaste which will be on that higher end rather than the lower end, particularly the ones which say, we get rid of staining and things like that. So I would beware a little bit, on that side of things, because at the end of the day, don't want to be wearing your teeth away by doing a good job.
I did hear somewhere once that if you've got a very thin scratch in something glass or plastic particularly, but toothpaste on a toothbrush might well wear that scratch away.
You got it right, exactly right.
And so when we're buying toothbrushes as well, can we still get the soft, the medium, the hard and all that kind of thing on the bristle?
The answer is yes, you can get all of these. For me, the best thing with a toothbrush is a small head. You've got to be able to get it round your mouth. I have to say that I think the best investment you can probably make is actually an electric toothbrush. There's lots of different models out there. My wife particularly uses an Oral-B one. I use a Philips Sonic Air one, and I find that they clean your mouth, and we know from the stats they clean your mouth significantly better than a manual toothbrush.
Well, I've got one of those brands, and the thing I love about it is it times it.
Yeah.
And it buzzes every 30 seconds. You'll know which one it is from that. But it buzzes every 30 seconds, so you do each corner for 30 seconds. Yeah. And you don't realise how long that 2 minutes brushing is until you're in the bathroom late for work. You're like, waiting for it, come on, got to get to work. But that's what you're supposed to do, isn't it? 2 minutes twice a day?
Everybody, there's a lot of people relying on mouth rinses, which just do not work. I was actually on a gum disease update on Tuesday night with my team, and the research is absolutely fundamentally there. You must mechanically clean the surfaces of your teeth. That's the only way of getting this biofilm of bacteria off your teeth. Chucking in a bit of mouth rinse does not work.
What about sugar-free gum? Some of the brands advertise themselves as being really good at not cleaning your teeth, but stopping that bacteria and
it's
things
more
forming.
I think it's more about increasing your saliva flow rather than cleaning your teeth. So if you chew gum, particularly after a meal, then you're going to increase the length of time that you're producing saliva, and it's saliva which puts your mouth back to normal, back to balance. So good saliva flow is absolutely critical.
I know this month is Mouth Cancer Awareness Month. We've only got a minute to talk about it, but what are some of the symptoms and how can a dentist help to identify the problems?
We're the experts at examining people's mouths. We can check the glands around your mouth, we can check the lining of your mouth. The problem with mouth cancer is it's generally painless, doesn't hurt, particularly in its early stages. What you may notice is an ulcer which hasn't got better. We always say if an ulcer's not better within 2 to 3 weeks, you must get it checked out. And the key bit with mouth cancer, and I stress this having worked in hospitals, the key bit is early diagnosis. The survival rates if we catch it early are very, very high. The survival rates if we catch it when it's late are very, very low. And it's so disfiguring, literally having your jaw or your tongue or the roof of your mouth completely cut away to get rid of the cancer, because that is the stage that we're still at with mouth cancer. It has to be surgically removed.
Fascinating as always. Good luck on your trip. Let
you.
us know how it goes. I'm sure you will. And thanks very much for coming back to us here at BBC Radio Stoke. Always love talking to Richard Howarth from Smile Style Dentists in Stafford. Coming up in the next half hour,